Dr. Chang, what information do you have for patients that are experiencing signs or symptoms of the coronavirus?
Any patient who thinks that he has been exposed to the virus or is having the signs or symptoms, first thing is he should try to figure out if he has been exposed to somebody who is coming from one of the areas which has had a high incidence of these case reports coming out from, especially like from China, from Italy, or from other European countries which at the current time are in the high category list. They should be looking for certain specific symptoms. The most prevalent of them, which has been put out by the CDC, is cough. Number 2 is a temperature of 100.4 degree Fahrenheit or higher. Number 3 is shortness of breath. So if any patient has all these three symptoms combined together, then definitely he is at risk and needs to be screened. Or if any of the relatives has come in contact with these kind of patient from these endemic areas, then yes, they should be screened.
So, what services or testing does Aegis and Lakeview have in place for their patients who are experiencing these symptoms?
Any patient who thinks that he has been exposed or at risk, he should call the office and get in touch with his PCP. We have our office staff who have been well trained, and they are able to ask a certain specific sets of questions to the patient and triage to see if they are at high risk. And if they are at high risk, then we have a drive-through system where patients can drive into our parking lot without exposing the other patients in the office at risk. We have a provider who is well gowned and protected, go out with an MA and take all their vitals, take all their history, do a physical exam on them, and swab their nose and throat for evaluating them for this virus. And thereafter, we are sending those kits out to the lab to be tested. And once we have the test results back, we are informing the patient of what the results are.
So, is this at all the Lakeview and Aegis offices or specific ones?
Right now, we have our Summerfield office and our Leesburg office, which we have got this process going. But down the road, we may roll it out for the other offices too. But right now, yes, these two locations are currently available for the patients to come into and get the testing done.
So, what additional services do we have on top of these services that you've already listed for us?
If for some reason the patient cannot come into our office parking lot, say lack of transportation, or because we feel that the patient is really truly a high risk, then we can even send Dr. Schnell. He's a physician who works with us very closely in the community, and he goes out to their house and he actually evaluates them right then and there and does the swab and sends it to the lab so that the patient care is not compromised.
Which patients are at the greatest risk with contracting the coronavirus?
Patients also at risk are those who have the immune system suppressed due to conditions like diabetes, chronic kidney disease, or other ailments like heart disease, ischemic cardiomyopathy, or a weak heart. So they are those who have been heavy smokers and have a diagnosis of COPD. These are especially patients who are relatively high risk and need to be watched very closely and to look for the symptoms as they come up.
What tips do you have for people who don't want to potentially get the virus or spread it?
Number one, try to avoid going into crowded places like bars, restaurants, theaters, arenas, stadiums. Number two, they should try to, if they go into, say, a grocery store, I would suggest that they should wear a mask if possible, and if they have one. I know it is in severe short supply at the current time, but that's what I would advocate. Third thing is, try to stay at home and see if you can do your work at home without having to go outside and unnecessarily expose yourself to the virus or getting it from somebody who may have it. These are the main precautions to take. Next, number two, most important thing is to keep hand sanitizers at home and wash your hands on a frequent basis. I think these two are the most important measures. Number three is don't kiss or hug anybody. If you have to greet someone, either you can use the Star Trek sign of this, or you can do the Indian style of doing namaste. So you don't give anything to anybody and you don't get anything from anybody. To summarize it, this is a dangerous virus, and it has been spreading exponentially. We need to take this condition as being extremely serious. We don't want to play down the symptoms. We need to recognize it early and seek help early. Second thing is, in Lakeview Healthcare System, we have the capabilities to deliver the care you need. Even though at the current time we do not have a vaccine for this virus or any treatment at the current time, but there are a lot of companies which are working on developing a drug to combat this virus. So we do have hope in the long run, but at the current time we do not need to panic, but yes, we do need to be vigilant and cautious about how we approach things and how we do things at the current time.